Hamilton is a rural community in southwest Victoria, 2 hours away from the next big hospital. My name's Kat, I'm a registered nurse at the Hamilton Family Practice. I've been a participant of the Transition to Practice program for 2025.
My name's Ellie, I'm a general practice nurse and I've been working in general practice for 8 years in Geelong, Victoria. I decided to join the Transition to Practice program in 2024 as a mentor. I understood that when you're transitioning from the hospital to primary healthcare, it's a very steep learning curve and there's a lot to know.
Having a mentor starting my job here in primary healthcare has made the biggest difference, because at the start I was really worried being here all by myself and not knowing who to ask questions to. Having that relationship with Ellie has been amazing, because she's someone that I can lean on and I could ask her any question and I didn't feel silly about asking it.
With us being so far apart, we weren't able to meet face to face, but we did our sessions via video call and we did schedule them fortnightly. In between times, she could always message me and reach out if she needed, which she did.
Being a mum of a toddler, it's hard to commit to things. So the fact that this program was online, it just made it so much easier. I could work 2 hours in the morning and do study, doing my modules, and I could message Ellie and say, yep, tonight's really great. We can do our Zoom chats then. And it just worked so perfectly.
Because Katrina was working in a rural setting, you don't have access to as many healthcare services. I was able to help her find resources online we could refer the patients to if it wasn't offered locally. So we started by working through the type of things you should discuss during a care plan and then what resources you give the patient to build upon that and provide them education. Katrina said that a lot of resources were helpful and she did use them.
The Transition to Practice program is funded through APNA, so I didn't even have to pay for anything, which is fantastic, because being a mum trying to pay for childcare and all that was one less thing I had to worry about.
I would recommend the Transition to Practice program for nurses who are working regionally or rural that might not have the in-house support within their clinic. The Transition to Practice program provides a foundation of education of all the modules and education that you would need to succeed in primary healthcare. And then on top of that, you've got access to your mentor and then the online community and the APNA staff.
It's also not just starting transitioning into program, it's building on new things, because everything changes and there's always new ways of doing things. So you might have been doing your job for 5 years, 10 years, and it's a great way to learn, well, what are the new processes now? So if you are working in primary healthcare or about to, the Transition to Practice program is definitely for everyone.